how much does age play a role in this? A lot.
A lot, but you know, young people have their share of back problems.
What's young? What's young?
Young, you know, someone like you, someone...
I was hoping that's what I was going for. So under what? Under 50?
I would say under 60.
Under 60, okay.
Yeah.
Okay.
Those patients develop disc herniations, which is kind of a young person problem, versus generally those over 60, over 65 develop more deformity or change in the shape of the spine.
All right. And why do people, why does your back hurt in the morning sometimes? Usually you're kind of stiff and then by the end of the day it's a little bit better.
Okay, so that's a tricky answer.
Okay.
So bear with me.
Okay.
So as you lose height,
okay,
various parts of the spine have to adjust. Specifically, there are these joints that bind all of your bones in the spine, and they're in the back. Now they're called facet joints. Now with time, those facet joints, they have to sort of accommodate a change in the position of the spine, and they sort of destroy some cartilage, and they kind of bend and they change. Well, whenever anything changes in the human body, your human body produces a certain reaction. Now, you can call it arthritis, but an intermediate stage to arthritis is essentially just joint stretch, which body does not like. And whenever that happens, it sort of makes it whatever it can to stop the motion of those segments. Now, when you wake up in the morning, after you get up from a nice, comfortable bed, those joints have not really seen the body weight, and they're in that least stretched position. Now you stand up and you ask your body to do things for you. You ask those joints to sort of open up and move the way that a normal person would expect. Well, that initial stage involves stretching of the joint capsules. And that's frequently what produces sort of like this flexed forward posture in the morning and the lower morning back pain. Now that being said, a late night pain, or for some of us an early morning pain that those of us that get up really early, can be a sign of inflammation as well. And actually, one of the things I ask my patients is, do you have night pain? And if the answer is yes, to me that implies that there is a strong inflammatory component to their problem.